Hello, it's Adrian Baker, nurse practitioner from Lumière Medispa. So let's talk about dermal filler risks today. Let's provide some balance to that, all those benefits that we see on social media. Let's provide some balance and know a little bit more about the risks of going ahead with those treatments. So generally, dermal fillers are a very safe treatment. However, there are risks you should be aware of. Most likely things, because it's an injectable treatment, most likely things would be bruising, swelling, redness of the area, just because it's been irritated, it's been injected. Also, if it's a hyaluronic acid dermal filler, then it will also pull some water to the area. So you could have some swelling in the areas that have been treated for a couple of days. And they're things that we would kind of expect. But it's important for you to take that on board because you need to make sure you plan socially and sensibly so that you know that you may have some bruises and you may want to stay out of the limelight for a little while. Kind of more serious risks that we don't expect to happen but can happen are things like infection. We are breaking the surface of the skin with a needle, and we could potentially transfer some bacteria into and around the implant site. So if you ever notice any extremes, so any extremes of swelling, any extremes of redness, any extremes of pain, please reach out straight away. Don't delay. It's much better that we know about it, and it may just be a normal thing and we can tell you that rather than leaving it and not wanting to disturb us. So please always feel free to reach out, and we have a WhatsApp number that you can contact any time of day should you have any concerns. Another side effect you should be aware of is that there is the potential for an allergic reaction. This is incredibly rare with a hyaluronic acid dermal filler. Most reactions, if they're going to occur, is usually related to the anesthetic that's added to them, whereas a true hyaluronic acid dermal filler usually won't cause you too much of a problem, but it's always possible. So again, any extremes, redness, heat, pain or discomfort, get in touch straight away and let us know. Related to allergic reaction, but not quite the same, is where you could experience a delayed onset reaction. And this could be weeks to months later after having a dermal filler treatment. And again, if the dermal filler is a very kind of pure hyaluronic acid, generally this doesn't happen, but it can happen with any hyaluronic acid implant. And essentially, it's where usually the body's immune system is not feeling too happy. You may have a cough or a cold or a sore throat, or even have had something like a COVID vaccine. And so the immune system goes onto high alert, roaming around the body, trying to attack anything that may be coming into the body. And it stumbles across the dermal filler and thinks, I don't like you, I'll get you too. And so you suddenly develop an onset of swelling in the areas. So if that happens and you do suddenly start having some swelling in areas that you've had treated, please get in touch straight away and let us know. There are things that we can do to help it. It's normally a short-lived reaction while the body's responding to another type of infection and should settle, but always get in touch and seek advice first. Probably the most scary side effect that potentially can happen, and thankfully is very, very rare, is something called vascular occlusion. And this is where, when we're injecting the dermal filler into the skin tissues, underneath the skin is like a roadmap of veins and arteries and vessels, which we can't see. We have obviously extensive training in anatomy, and we have an understanding of where is slightly safer for us to inject and at what levels is safer to inject, and which products should go in certain areas as well, to try and avoid that from happening. And if the dermal filler then injects into one of those vessels, it could stop the blood flow to the surface of the skin. And this would normally happen almost immediately with your practitioner, and we would see a very unusual discoloration happening to the surface of the skin, i.e. that the blood isn't getting there. And it's really serious. So we do always have an emergency pack ready to go should that happen. And we would be injecting a prescription medication that actually dissolves that dermal filler or turns it more into a liquid to release the pressure from the vessel. And this hopefully will then restore the blood flow to the surface of the skin. However, if it was to be missed, or if it was left, or it wasn't dissolved in time, it could mean that that area of skin or underlying tissues could actually die off, and you could be left with a wound in the skin. So again, if you have any concerns that there's an unusual discoloration or there's extremes of pain or swelling in an area, just reach out to us. Again, it's always better that you reach out and clarify, and if it's not a problem, then great. If it is, we'll have you in straight away to try and deal with the issue. Something else to consider with a dermal filler treatment is that you may not like the result. So it may not have been quite what you were thinking it was going to be. And I would urge you at your first convenience to just get in touch with us and talk about it with us to make sure. It's not something that happens very often, thankfully, but we want you to be very happy with your treatment results. And leading from that, sometimes it's the fact that you may have a little lump or a bump, just where the dermal filler may have just sat a little bit proud in the skin. And these are things that we can deal with and help you with. So it's nothing necessarily for you to be worried about. It's just something that you need to talk to us about so that we can help you. So I hope that all helps balance that risk versus benefit profile and provides you with the details of the risks of dermal filler treatments. But please do always seek the most advice from the practitioner who's going to be treating you, who should have already informed you of all of this during your consultation. Take care and have a great day.